All right, awesome. Thank you, Anne and the health educators. And good morning, everyone. You have made it to day 3 of the training. Congratulations. My name is Lindsey Lastinger, and I am the deputy lead for the acute care analytics team with NHSN. And thank you all so much for being here this morning. I am here speaking to you today on behalf of a very large team working on the NHSN Rebaseline project. And we are all excited to see all of you here and to see that you're interested in learning more about the HAI Rebaseline. There are a group of my colleagues who are on the line, and they are standing by to answer any question that you might have throughout the presentation. So at any time during the session, please feel free to submit your questions into the Q&A box, and we will work to get those questions answered for you. And throughout the presentation, there are a few polling questions where you will have an opportunity to submit an answer directly on the screen into the poll. If for some reason you don't see the poll or you're not able to submit an answer, you can always drop your answer into the chat box, and we will make sure to take those into account. And one final announcement before we get started. A few small changes have been made to these slides, and the latest version is available for you to download directly from the platform. If you downloaded these slides yesterday or today, you should be good to go. But if you downloaded an older version on Monday or late last week, just know you might see a few text changes here and there on the slides. But the latest version is already posted and available to you if you're interested. All right, so with all of that said, let's jump in to learning about the Rebaseline. My session is titled Prep Like a Pro, What to Expect from the 2022 HAI Rebaseline. And the objectives for this presentation are really focused on making sure that all of you, the NHSN users, have an understanding of how the Rebaseline will impact you and what sort of changes you're going to notice in the NHSN application when you run analysis reports on your data. So for today, we are not going to talk about modeling. We're not going to be talking in depth about risk adjustment or the variables that are used for risk adjustment. And this presentation won't be a deep dive into the SIR or standardized infection ratio itself. All of that content will be available to you later this year. So for today, we're really going to talk about some practical concepts, how the Rebaseline may change the way you analyze and interpret your data, as well as what you can expect from us, the NHSN team, later this year in terms of additional educational resources and a lot more training opportunities that you will have. So this is just one presentation today of many future Rebaseline presentations that you will have the opportunity to join. But before we can talk about what to expect and how you can prepare yourself for the Rebaseline, I do need to make sure that we are all on the same page about what the Rebaseline actually is, what that term means, and then we'll do a very brief crash course on the standardized infection ratio, just to make sure we all have an understanding of one of the metrics that is involved in this Rebaseline. So that is where we're going to start today, a high-level overview of the Rebaseline and the SIR. And before we jump into that, we have our first poll question, just to get a sense of who is in the audience today and whether or not you have any prior knowledge of the Rebaseline. So please feel free to select your answer in the poll. All right, we'll give it a few more seconds. All right, looks like About 75% of those have answered the question. We have a good mix here. About a third of you have never heard of the rebaseline. So we are glad that you're here today. And another third or so have heard the term, but may not be very familiar with the concepts. So that is great. No matter how you answered this question, we are glad that you're here, and we hope that this presentation will be informative for you and will help you understand some implications to your own work. Okay, so let's start with a high-level overview of the rebaseline. The term rebaseline is the name that we use for a process that the NHSN team is undertaking to update the calculations for the standardized infection ratio, or SIR, and the standardized utilization ratio, or SUR. So these are the two metrics that we use to measure incidence of HAIs and device utilization in your facilities or your group, as well as at the state level and at the national level. These metrics do require a baseline from which we can measure progress. And at some point in time, that baseline needs to be updated. Currently, when you are running SIR or SUR reports in NHSN, you are seeing a comparison of your facilities data to a 2015 baseline. And for a variety of reasons that you can read more about on our Rebaseline webpage, the decision was made that the 2015 baseline is just starting to get a little outdated. And so we will be updating that baseline to use 2022 data. So that is what the rebaseline is. It is updating the baseline used for the SIR and SUR to a more recent time period. And in this case, we will be using 2022 as our updated national baseline. Okay, so next we're going to talk more about the SIR, which is one of the metrics that is part of this rebaseline process. And we actually have our second poll question. How many years of experience do you have with analyzing NHSN data? All right, looks like about 30% of you have less than 2 years of experience. And we do have 18% that have over 10 years of experience. So we do have quite a range of different years of experience, which is really great to see. And thank you for participating in this poll. All right, so let's get into our crash course on the standardized infection ratio. So this metric is a ratio where the numerator is the number of observed HAIs and the denominator is the number of predicted HAIs. So the numerator, the number of observed HAIs, you all know about this. This is based on the HAIs that your facility is reporting directly into NHSN. So this is the number of HAIs observed in your facility. The denominator, the number predicted, this is something that the NHSN system calculates for you, and it is calculated using formulas that are created by CDC. We will talk more about this on the next slide. When the number of observed HAIs is greater than the number predicted, meaning that your numerator is greater than the denominator, the SIR is going to be greater than 1. And there's an example here on the slide. If the number of observed HAIs is less than the number predicted, then the SIR will be less than 1. And when we talk about interpretation of the SIR, we usually also talk about p-values and 95% confidence intervals. Now, I promise that I'm not going to get too technical here. We're talking about how these numbers are calculated. But I'll just say that they are two statistical values and they are calculated for you in NHSN, and they provide you with information about whether the number of observed HAIs is statistically significantly different than the number of predicted HAIs. So these values can help you interpret the SIR. Okay, so as I mentioned before, the number of predicted HAIs is calculated by the NHSN system, and it is calculated specifically for your facility using a type of regression model, what we refer to as risk adjustment models. So these models will look at characteristics of your facility, and they will take into account the types of characteristics that play a significant role in the incidence of that particular type of HAI. So this includes characteristics such as the number of beds or the average length of stay for patients in the facility. You can read more about our current risk adjustment models and which specific characteristics, also called factors, are included in those models by reviewing NHSN's Guide to the SIR. And there is a link at the bottom of the slide to that PDF. So these risk adjustment models are created by the CDC team, and they are created based on all of the HAI data that are reported into NHSN for a given year that we identify as that baseline year. So the current reports that you can run in NHSN for the SIR, they are using models that were created from a 2015 baseline year, which means that the SIR is providing a comparison of your facility's data to that 2015 national baseline. So when we talk about a rebaseline, we are talking about updating that baseline year to a more recent year and also creating new risk adjustment models based on that more recent year of data. And in this case, that will be 2022. Okay, and for some of our newer team members in the audience who may be newer to your role or newer to using the SIR, this is a very widely used metric. It is used across various agencies, especially those within the Department of Health and Human Services. It is used in various surveillance reports by CDC in order to track HAIs over time. And it may also be used in surveillance reports by your state or local health department. For some facilities, the SIR is publicly posted by some of these agencies, such as CMS or a state health department. And other facilities may be using the SIR internally for infection prevention purposes and tracking HAIs over time. So there are some screenshots here on the slide showing you a few of the ways that the SIR is used at CDC. Okay, so now that we know a little about the SIR, we're going to talk about what will change and what will not change with the SIR as a result of the rebaseline. Okay, so first, rest assured that the formula for calculating the SIR will not be changing. This is the formula that we just went over. It appears at the top of the slide, and it is the number of observed HAIs divided by the number of predicted HAIs. Okay, so you've got that down. That's not changing. All right, the second bullet here is that the criteria for the SIR numerator are not changing. So for example, you might be familiar with the fact that in some situations, certain HAI records are excluded from being counted in the numerator of the SIR, such as the community onset MRSA bacteremia or the community onset CDI lab ID events. So that is not changing. The SIR numerator is not going to change. However, what will be new for the SIR is the way that we calculate the SIR denominator, the number of predicted HAIs. So after the 2022 baseline is implemented in NHSN later this year, users will have the option to run their SIR reports using updated risk adjustment models that were created from that 2022 baseline data. But it's really important to understand that the current SIR reports that use the 2015 risk adjustment models and the 2015 baseline, those are not going anywhere. So you will still have the option to use the 2015 baseline and the 2015 risk models if you want to when generating an SIR report from NHSN in the exact same way that you currently are doing it. So you will have plenty of time to get adjusted to the new models. There is no pressure. There's no pressing deadline for you to immediately stop what you're doing and adopt the new baseline and incorporate these new SIR reports into your work. And we will talk a little bit later towards the end of the presentation about timelines, but just know that you will have the option to use either baseline in your work. Okay, so when the new risk adjustment models become available in NHSN, it will allow the SIR to provide a comparison of your facility's HAI data to a more recent national benchmark. So let's look again at the SIR formula and see what has changed when we consider the 2022 rebaseline. So the numerator of the SIR, as we just mentioned, this is not changing. This is still the HAIs reported into NHSN. The denominator of the SIR, this is where we see a change. So after the rebaseline is implemented, the denominator of those new SIRs will be calculated based on new 2022 risk adjustment models. Okay, I'm going to give you a very high-level bird's eye view about the process for the NHSN team to create these new risk models. So our statisticians are currently analyzing national data from 2022 and creating new risk adjustment models for each of our HAI types and healthcare settings. There are two types of models that are currently used in NHSN's risk adjustment under the 2015 baseline, and these are the same types of models being created for the 2022 baseline. So these models are called negative binomial regression model and logistic regression models. So if you are interested in more details about these types of models, you can refer to our SIR guide. Overall, for the entire 2022 rebaseline process, the team will be creating over 200 individual risk adjustment models, and there will be separate models for each healthcare setting and HAI type that is in scope for this project. We'll get into that in a couple of slides. All suitable factors are being assessed for a statistically significant relationship with the incidence of each HAI. So this includes factors from the annual survey, data that you entered during enrollment in NHSN, as well as your location mapping information, and other factors that are entered that are available at the facility level. So things like CDI test type, what represents the whole facility, or factors that are available for all patients in the numerators and the denominators. So this would be the factors entered on the procedure form. The significant factors that end up being identified in these models may differ by HAI and/or setting. Okay, so we are now going to jump into a sneak peek into the rebaseline implementation process, and we will run through a practice exercise on how these new models will be implemented into NHSN and what the new SIR reports will look like. All right, so here is some information about the scope of the rebaseline. The tables on the right list the facility types, the HAI types, and the devices that are being analyzed and assessed for new risk models. And I mentioned earlier that there are over 200 models being created, which means over 200 models that will be implemented into the NHSN application for all of you to use. So that is a lot of models to create, and it is a lot of new reports that need to be developed and tested in the application. So our team is using a phased approach for the rebaseline. There are different phases of the modeling work, and there will be different phases of implementing those models into the application through new SIR reports, SUR reports, TAP reports, and an update to the TAP dashboard. So TAP stands for Targeted Assessment for Prevention. If you are not familiar with the TAP strategy, you can read more about it at the link at the bottom of the slide. The ultimate goal is to complete the implementation of all 200 models or so by the end of this year, so the end of 2024. And as I said, these new analysis reports, they will use the new models, and they will slowly become available throughout the year in different batches or different phases of development work. And again, more information about the timeline will be shared with you as we get closer to implementation. And we do have a high-level timeline at the end of this presentation that we'll go through as well. Okay, so here is a screenshot of NHSN's tree view. So this is the menu that you would navigate to in order to identify and run analysis reports within NHSN. And the top folder of this tree view is called HAI Risk Adjusted Measure Reports. And if you open that folder, you currently will see two subfolders. One is called the original baseline or baseline set 1. And another subfolder exists for the 2015 baseline, which is our current baseline, or baseline set 2. So you will go to these folders, and this is where you can find the SIR and SUR reports on either of those baselines. And as we start to add SIR reports that use the 2022 baseline, you will see a new subfolder that will be added into the tree view for the 2022 baseline or baseline set 3. Okay, so this will hopefully make it very clear to you where to go within the tree view to run an SIR report based on whichever baseline you are planning to use. And just remember that the earlier baselines will remain available in those other subfolders that you see here on the screen. Okay, so once these new reports on the 2022 baseline are created, here is a list of everything that you will see in those reports that you are actually already familiar with, because it is exactly the same as what you can find in our current 2015 baseline reports. So the first item here is that the SIR is only calculated when the number of predicted events is at least 1. So that is not changing. You will see that rule applied to the new reports as well. The general look and feel of the new reports will be very similar to what you're used to. The same colors, the same font style, the way that the tables are formatted and structured, all of that will stay the same. The same types of statistics will be provided to you, the p-values, the 95% confidence intervals. Those columns will still be shaded in yellow as you're used to. The same report modifications and the same export functionality will be available on the new reports. The same functionality for groups will exist. And certain model characteristics that are used to calculate the number of predicted events will also stay the same. So for example, for Clabsy and County, those models are based on location data, and they provide a risk adjustment based on the type of unit that has reported those data. So that is not changing. For surgical site infections, we have 3 model types, and those model types will still exist under the new baseline. We have the all SSI model, the complex AR or complex admission readmission model, as well as the complex 30-day model. And for MRSA and CDI lab ID events, those SIRs will still be available for the facility-wide inpatient location, what we call FAC-wide in. It will also be available for inpatient rehab facility units. Okay, so now that we have talked about what is staying the same, we're going to talk a little bit about what will be different in the new reports. And the first bullet here is emphasizing the time period of data that you can use when analyzing SIRs on the new baseline. So when you run reports on the 2022 baseline, you can do that for your 2022 HAI data and forward. Okay, so if you want to analyze your facility or your group's HAI data from 2021 or earlier, you'll have to use the SIR reports on the 2015 baseline. Okay, so the 2022 baseline is going to start with 2022 data. There are a few other differences you might notice in the new reports. There will be some different footnotes. There may be some changes to the inclusion or exclusion rules in some rare scenarios. You'll also see new report names and titles. There will be a new placement within the tree view that I just showed you for those new reports. So there will be some modifications to the supplemental data tables that are shown within the report, such as a table that shows you the data excluded from the SIR. You may also see different variables being included in the source analysis data set that you can export if you want to. And you'll also see new names for those analysis data sets. But the biggest change when using SIRs under the 2022 baseline, it may not be from the reports themselves, but it's actually how you interpret the data being shown in those reports. So SIRs under the 2022 baseline need to be interpreted differently compared to SIRs under the 2015 baseline. Okay, and we're going to walk through an example of how to interpret these results. Okay, so first, if you are running an SIR on the 2015 baseline, you will interpret the number of HAIs at, the number of predicted HAIs as the number of HAIs predicted to occur in a facility based on the national HAI incidence levels and surveillance definitions and risk models from 2015. And the SIR answers the question, how does the HAI experience in my facility compare to what was predicted for my facility based on national HAI data and risk models from 2015? Now, if you generate an SIR in NHSN on the 2022 baseline, you'll need to interpret the data a little bit differently. So the number of predicted HAIs are those that were predicted to occur in a facility based on the national HAI incidence and surveillance definitions and risk models from 2022. And the SIR will answer the question, how does the HAI experience in my facility compare to what was predicted for my facility based on national HAI data and risk models from 2022? So the SIR on the 2022 baseline is offering a comparison of your data to a more recent set of national data. Okay, so sometimes change can be a little hard, and as much as possible, we don't want anyone to feel nervous about this. The rebaseline is really exciting. It's going to bring with it a lot of improvements in the reports that you use and the comparisons that are available for you to track your HAI data. And the good news is that the NHSN team has done this before. This is not our first time doing a rebaseline, and we are here to help you feel as comfortable and as prepared as possible to use the new baseline. We will have ample training materials and webinars and fact sheets and everything you need to understand the new reports. And just remember that the models and the reports will be implemented into the application in a phased approach. The current reports are not going away, and you can take your time to get familiar with the new reports and to read and really soak in all of the educational materials that will be available to you. All right, so it is time for our third polling question. We'll see if folks were following along on the past few slides. So which of the following choices best describes how the SIR will change as a result of the 2022 baseline? All right, it looks like most folks are getting the correct answer here. Correct answer is C. The formula for calculating the SIR denominator, or the number of predicted HAIs, will change. So as we mentioned, there will be new risk models based on 2022 national data that will be used by CDC to calculate the number of predicted HAIs. All right, so let's take this information for a little test drive. Let's do a practice exercise here. So here is a screenshot of what a portion of the new SIR report might look like on the 2022 baseline. Right off the bat, this should look familiar to you. The same sort of columns, the same sorts of data are being provided as you can see in our current 2015 baseline reports. This example is for MRSA bacteremia data in an acute care hospital, and we are looking at 2022 Q1 data. So the first thing to point out is the title of the report. Above the data table, you can see that the year of the baseline is indicated. The column headers in this table are exactly the same as the column headers in the current MRSA bacteremia SIR report. It's just that now the 2022 national baseline and risk models were used to calculate the number of predicted events. All right, so let's look a little closer at how we're going to interpret this report. Okay, so first, the facility reported 3 healthcare onset MRSA bacteremia incident lab ID events and 1,450 patient days. Based on the 2022 baseline and risk models, NHSN predicted 2.5 healthcare onset events to have occurred in this facility. So our SIR here is 3 divided by 2.5. That gives us an SIR of 1.2. So because this SIR is greater than 1, this means that the facility did observe more HAIs than what was predicted by the 2022 national baseline. The p-value shown in this report is 0.6986, which is greater than the cutoff point we use at CDC of 0.05 for statistical significance. So in this case, this means that there's no significant difference between the number of observed HAIs and the number that were predicted based on the 2022 national baseline. All right, I know we talked earlier about the fact that the SIRs on the new baseline should be interpreted differently than the SIRs on the 2015 baseline. So this slide is really to emphasize that point, that SIRs on either baseline should not be directly compared to each other. Those SIRs provide a different story. They're telling you something different about your data, and they're based on different baseline time periods, different risk models, and different inclusion and exclusion rules. So let's go back to our practice facility, and let's pretend that the facility was interested in seeing an SIR for that same quarter of data calculated under the 2015 baseline. So here's a screenshot of the SIR report from the 2015 baseline. You'll see that this report is showing the same number of observed HAIs and the same number of patient days that we saw on the 2022 baseline report. Based on the 2015 baseline and risk models that were used in this report, we see that NHSN predicted 3.2 events to have occurred for this facility. So now, when compared to the national 2015 baseline data, this facility technically observed fewer events than predicted because our SIR is less than 1, 0.938. However, the p-value shown on this report is still greater than 0.05, so there is no significant difference between the number of observed and the number predicted. So under both baselines in this purely fictitious scenario, we saw that the SIR was not significantly different from 1. And under the 2022 baseline, the SIR value itself was greater than 1. And under the 2015 baseline, the SIR value was less than 1. So these SIRs are telling you different information because they are providing a comparison of your facility's data to different points in time, different years of the national baseline. All right, so in the last section of the presentation, I'm going to talk about some final thoughts, answer some FAQs, and provide a high-level timeline for the project. So we have been asked occasionally how the NHSN team accomplishes this rebaseline project. And I will tell you, it is a very involved project. It spans multiple years, multiple phases, and requires extensive collaboration with various teams within our division. So I have listed just a sample of the different types of individuals and experts in our division who are contributing to one phase or another of this rebaseline project. This includes statisticians, analysts, infection preventionists, health educators, communication specialists. We have liaisons to different partner organizations, and of course, our entire NHSN development team and our user support team. And that is just to name a few. So I did mention that there are different stages of the rebaseline. So we started over a year ago with the planning and the research stages. We then have moved into the analysis stage, which is where the modeling occurs. We also have separate stages for implementation, for communication and education, and for policy implementation. So we have internal and external subject matter experts that are consulted during each of these stages, and the team continually assesses progress in each of these stages and identifies how and when to best engage with our NHSN users and partners. All right, so this is our current rebaseline timeline. This is subject to change, and you all have a copy of this in the slides, so feel free to look through it on your own if you're interested. But I will just point out where we currently are at, which is March 2024. The different colored boxes on this timeline do correspond to different stages of the rebaseline. And right now we have 3 different stages where work is occurring simultaneously. So we have some education and communication, that's the purple box right here. We're getting ready to launch our formal plan for education in conjunction with this annual training. Our statistics team is also currently working in the analysis phase right now. So that's this yellow box. They're generating those new risk adjustment models. And then we are also working in the implementation stage, which is this green box up at the top. We're starting to draft our business requirements for the application and working out the details about how those new SIR reports will work. All right, so throughout the rest of this year, please consider trying to stay informed and follow along with any information you see in the NHSN newsletter or on the NHSN Rebaseline webpage. This will help you feel prepared and comfortable once those new SIR reports begin to roll out. So currently on our Rebaseline webpage, we do have information posted on the scope of the project, and we have an FAQ document that is posted for you. And we are planning for additional resources to be added to this webpage in the coming months. So please stay tuned. And also keep an eye out for any articles that are related to the rebaseline that you might see in the NHSN newsletter. So this brings us to our fourth poll question. How do you prefer to receive updates and communications from us related to the HAI rebaseline? We will have a separate poll question that asks you about education and the format you prefer for education. This question is specifically asking about communications and updates and the way that we share information with NHSN users. All right, looks like a lot of folks actually prefer emails or have no preference, with only 5% of respondents indicating newsletter articles. So thank you for sharing this information with us. We will definitely take this into account as we continue to refine our communication plans. All right, so we're going to finish up here with some information on what you can expect from the NHSN team. So the new SIR and SUR reports are not available just yet, but we will provide you with more concrete dates and timelines in advance, so you will know what's coming. There will also be numerous educational opportunities on the rebaseline throughout the rest of this year. As I mentioned, webinars, quick learns, fact sheets. We will be creating an updated version of NHSN's guide to the SIR. That's where you can go to actually see the details of the new models once they're ready. There will also be documents to help you understand and navigate those new reports in the application. There will be a lot more presentations from the NHSN team about the new models, how to interpret them, and how the SIR values themselves may look different under the new baseline compared to what you're used to seeing under the current 2015 baseline. All right, and the NHSN team is also continuing to work with our colleagues at CMS to understand the impact of the rebaseline on CMS programs. No timelines have been set for the incorporation of the new SIRs on the 2022 baseline into the CMS quality reporting programs. But you can definitely look out for more information as we hear more from CMS about their plans. I'm sure that will be widely communicated to everyone. We also appreciate when you send in your questions to the help desk, or when you've been putting your questions into the Q&A box during this presentation. It really helps us tailor our educational content to make sure we are addressing your needs, we're answering your questions, and we are providing you with everything you need. So please feel free to email us questions after this presentation. You can submit them through ServiceNow or by emailing the NHSN Help Desk. And you can use the subject line 2022 HAI Rebaseline. And I know we have just about 1 minute left. We do have a final poll question if you'd like to answer how you prefer to receive education from the NHSN team related to the HAI rebaseline. And while folks are answering that question, I do just want to thank all of you so much, for those of you in the audience, for everything you are doing to keep patients safe in your facility, and for your dedication to the surveillance and the analysis of HAIs. And I do want to give a special thank you to the health educators who organized this session, as well as the panelists, Maggie, Rebecca, Catherine, Prachi, Karen, Jonathan, Kevin, and Matt, who have been answering your questions in the Q&A box. I do see you've had a lot of questions. Thank you so much for sending those in. Thank you to the panelists. And as far as education, it looks like live webinars is the most popular option there with 39%. All right, and that concludes my presentation.